All right, in this part of chapter 16, turning our focus now to some of the physiological changes that occur during aging, and then wrapping up with our brain health. Now, some of the changes that occur as we age, so body composition, a condition called sarcopenia. This is a loss of lean body mass, again, loss of muscle, non-fat cells. The muscles start to shrink or completely become lost. They're less elastic, so they can't stretch and relax as much. Then that leads to an accumulation of fat and collagen that leads to the sarcopenia. Sarcopenia obesity is a loss of that lean tissue that we just talked about, but also an increase in fat and just a decreased amount of body water within our cells. Now, bone loss is expected consequence of aging. It happens more rapidly in women after menopause. It's just a slower, steady decline in men. We've talked about osteoporosis before, but also osteomalacia. This is insufficient vitamin D, so the calcium's there, but it's not getting absorbed, so it can be undiagnosed. Osteoporosis, of course, the loss of bone mass and density can be very detrimental, causing a lot of hip fractures, breaking of bones. So it can be preserved with weight-bearing exercises, adequate vitamin D, calcium, and protein intake, and then also not smoking and drinking can help preserve those calcium levels. Joints as we age causes arthritis. So there are about 100 different forms of arthritis affecting millions of people. This is ultimately, though, due to the deterioration of cartilage that covers the joints and protects them. So a few different types. Osteoarthritis, this is the leading cause of disability in older adults. Rheumatoid arthritis, this is actually an autoimmune that's actually more prevalent in younger adults. Gout affects multiple millions of people. This is a painful arthritis that happens really quickly and typically is related to changes in eating patterns, especially with salt and iodine and thyroid issues. So recommendations here, so just dietary patterns rich in those antioxidants, anti-inflammatory phytochemicals, and those healthy fatty acids. Now, digestive system changes. Of course, digestion starts in the mouth. Again, older individuals typically are missing all or some of their teeth, so it's harder to chew food, so they avoid those foods, especially like meats. So then they lack the protein, the iron, and the zinc that's provided for. And even pureed food can become necessary. In addition, in their mouth, they're also producing less hydrochloric acid, intrinsic factor, and different enzymes. So that means they're not breaking their food down as well. They're not absorbing vitamins as well. The gallbladder and pancreas that are helping release those enzymes and breaking down the fats declines. And then constipation is common due to an increase of fiber, to offset that, we increase fiber, fluid, and exercise. With the nervous system, there's a gradual loss of nerve cells. So that leads to that decrease of sense of taste and smell, so less likely to want to eat, just doesn't taste the same. Impaired coordination, reasoning, and memory. Of course, we think about Alzheimer's disease there, but just the ability to prepare meals then becomes difficult. Hearing and vision decline. The curtails social and physical activities, so they can't get out and do things. They don't want to be around other people. They can't hear them. As far as vision, that macular degeneration that causes an eye disease, that affects millions of people. So again, diets rich in those carotenoids and retinoids, those colorful fruits and vegetables, help decrease that risk. The immune system, unfortunately, declines as well. It's less efficient. So our proteins, folates, and different vitamins help maximize that immune health. Overnutrition, though, so too much fat or food, obesity, iron, too much iron or zinc can actually be harmful to the immune system. So that makes food safety even more important. So it's very important, to wash our hands, wash our foods when preparing foods because they're more sensitive, more likely to get an infection. Changes to the endocrine system. So hormone synthesis slows. So thyroid hormone production decreases at basal metabolic rate that typically leads to weight gain because our calories don't offset as much. We become more insensitive to insulin. That leaves more glucose in our blood that attaches to all those proteins to cause glycosylation. So the recommendation is to enhance the use of insulin and restore that blood glucose by keeping a healthy weight, physical activity, keeping diets low in fat, high in fiber, and staying away from those processed foods. Now, if we look at some of the chronic diseases, the incidence increases with age. Examples are obesity, heart disease, osteoporosis, cancer, hypertension, and diabetes. And more than half of older adults have at least one of those diseases, and 4 out of 10, so almost half, have 2 chronic conditions. So again, that increases that aging process, the more conditions that the body is dealing with. So obesity, heart disease, or osteoporosis, all of those make it harder to get out and move, makes it harder to shop and prepare meals, which just then adds to poorer diet, more fat, and reinforces those conditions. And then in cancer, we have increases those nutrient and calorie needs to help with that. Whenever we look at different medications, so older adults, about 90% take at least one prescription medication every day. 40% have 5 or more medications that they take every day. So many of them can actually interact with nutrients and alter the needs that can affect appetite. So even though nutrients are coming in, they may not be being absorbed as well. Antibiotics, if they're on those for some of those, because their immunity is down, those kill the good bacteria. We need bacteria to make the vitamin K to help with blood clotting. Iron supplements can interfere with other mineral absorption like zinc and copper. Diuretics that are common with those with heart disease, that causes potassium to leave the body. Using aspirin long term can cause anemia and a loss of iron, which is common again with those with heart conditions. So what are some of the benefits of having optimal nutrition throughout our life? So again, this delays the onset of some of these diseases. Again, some of these chronic diseases eventually are going to happen. You're just trying to delay them. Improves the management of existing conditions, hastens our recovery so our immunity is better, so we get over sicknesses better, increases our mental, physical, and social well-being, and ultimately just improves our quality of life. So if we look at kind of the My Plate here for older vegetables, of course, half the plate's still those fruits and veggies. Again, fluids are extremely important. Again, whole grains are important. Fat-free or low-fat dairy is important to keep that calcium and vitamin D. Our protein is important for the iron and the zinc that is needed to keep cells functioning. Right, so our last little section here is focusing on brain health. So extremely metabolic active organ, always doing something. So it requires that continual supply of energy. Glucose is what's preferred here to meet that demand. So again, coming from our carbohydrates. So about 20% of the body's blood goes to the brain to give it the oxygen and the glucose that it needs. And it's actually about 60% fat by dry weight. That's why consuming higher fat as an infant is really important to help with that brain development, and those omega-6 and 3 fatty acids, extremely important to keeping our brain healthy. So those, again, nutrients to help with that, again, fatty acids, as I just mentioned, but also choline. So omega-3 and 6 fatty acids, that's the alpha linolenic and leolinic. Acids, again, they form the phospholipids that make up our cell membranes to build those brain and nerve cells. Choline is also an important part to making the phospholipids, as well as the sphingomyelin that makes the myelin sheaths that go around our neurons to improve conduction. And again, we just have a higher amount in the nervous tissue, so we need to ensure that our diet has plenty of these building blocks to make those nerve cells. Now, iodine and iron also play a part. Iodine, this helps with that myelination. So again, the sheet, like the coating on a wire that insulates our neurons. It's very important, especially right after birth. So maternal iodine deficiencies actually can cause some cognitive deficits because then the infant doesn't have enough iodine initially. Iron is very important here to help fuel the brain, helps with that myelination as well as forming different neurotransmitters that are important for that communication. So those iron deficiencies or anemia, that can decrease brain growth and development that can cause learning abilities and behavioral problems. Again, our nutrients, glucose is that preferred fuel source for it. So it relies on that from its last meal. So during fasting, so in between meals, that glucose comes from that glycogen in the liver that's stored there, or amino acids can be broken down to provide glucose, but that causes the production of what are called ketone bodies. So during starvation, so if we're not then replenishing those stores, then we're breaking down amino acids for glucose, and that produces these ketone bodies that's used during fatty acid metabolism to get glucose. That leads to high ketone levels and causes our pH to become more acidic. So then our micronutrients, though, are also important here, especially our B vitamins, iron, but also the zinc, many others there. So those deficiencies can cause an impact to brain function. So how do we protect the nervous tissue? So those antioxidants and phytochemicals are extremely important to help with that oxidative damage, like vitamin C and E, selenium, zinc, beta carotene. Again, all of these help preserve and reduce those free radicals and the damage to our cells. High levels of homocysteine. This is one of the risk factors associated with Alzheimer's disease. So limiting that, keeping that homocysteine metabolism down. Excess body fat. This negatively impacts our cognitive function. Again, we need some fat, but not too much. Insulin resistance. Whenever we have too much sugar in our blood, it binds to proteins that alters everything, especially brain health. And then physical activity improves that brain development, attention, and memory. So what does our healthy brain look like? So again, we've mentioned all these, but just going back through all the ages. So during gestation and early infancy, again, very critical periods for brain growth. So it's important that all the maternal nutrition is normal. Folate, again, we can't talk about folate enough whenever it comes to embryonic development in the neural tube activity, but also our vitamin B12 and our proteins, those omega-3 fatty acids and iron are extremely important during gestation. So iron deficiencies causing a decrease in attention, poor memory, and disruptive behavior. So keeping up with those iron. Good iron status, though, helps prevent lead poisoning. So it prevents its absorption even if you are exposed. And that lead can be extremely detrimental. So again, lots of iron helps keep the lead away. During puberty, during those growth spurts, though, again, iron is important to build those muscle cells and lean body tissue, as well as expanding the blood volume. And then in adolescent girls, require additional iron to help compensate for the menstrual cycle that begins with that loss of blood.